Hello, I'm Sarah Bellinger with the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. A report from HHS this week found that benchmark health policies on the exchange will rise by 25% on average for 2017, and consumers in many markets will now have fewer choices than they did this year. But there's wide variation in the price hikes, with 11 states seeing reductions or increases in the single digits, and 20 states seeing a price increase of 20% or more. A report from Avalier Health pinpoints a problem that some experts identified back when the Affordable Care Act passed in 2010, that penalties for going without coverage are not steep enough to force the young, healthy adults to buy coverage. CMS has doubled its budget to encourage younger adults to enroll in 2017, and the CEO of Healthcare.gov, Kevin Cunahan, said this week that the government will take steps to crack down on abuse of special enrollment periods in 2017. For more, visit ajmc.com. Medicare Advantage has grown since the Affordable Care Act passed and now accounts for 32% of all Medicare beneficiaries. That's what keynote speaker Sean Cavanaugh, Deputy Administrator and Director of the Center for Medicare, told those attending this week's National Conference on Medicare, convened by America's Health Insurance Plans. Cavanaugh said that the ACA raised questions about Medicare Advantage that ended up being unfounded, and that 2017 is expected to bring a 4% reduction in premiums. However, Medicare Advantage won't escape the challenges of rising drug costs that have affected all of healthcare. Said Cavanaugh, while we have successfully held down premiums, I think it's very important to note that there are cost problems in the Part D program we have to address. For full coverage of the AHIP conference, visit ajmc.com. This week, New Jersey became the latest state to address the problem of surprise medical bills, which have become a high-profile consumer issue as more patients have benefit designs with high out-of-pocket costs for out-of-network emergency care. Catherine Hempstead of the Robert Wood Johnson Foundation recently told AJMC that changing benefit designs may be affecting consumer behavior when it comes to emergency care.
Well, there's probably two things going on with emergency care that might be making patients be a little bit more cautious. I think one thing is that benefit designs have really changed, so that cost sharing for emergency department visits are really going up. So I think a lot of patients are, rethinking about whether to visit the emergency room or go to an urgent care center or go to a retail clinic or go somewhere the next day. So I think there are some changes in the structure of benefit design that are making people think twice before going to the emergency room for something that's not an emergency. But then the other point you raised, I think, is really important too, because this publicity about people going into the hospital for a scheduled procedure to an in-network hospital and being unintentionally treated by some out-of-network providers, or going to the hospital in an emergency, a true emergency, and being treated by out-of-network providers and getting big bills. That's been getting a lot of airplay, and I think consumers are increasingly aware of that possibility, and that's probably factoring into people's decisions too.
What strategies are working for those practices that have seen success with the Oncology Care Model? An expert panel looked at that question this week at Payer Exchange Summit 5, sponsored by the Community Oncology Alliance. Their recommendations included building a nurse triage system into the platform, forming a relationship with a palliative care company, focusing on care coordination. However, panelists said that the model needs some changes, including the ability to add staging and mutations data. Physicians encourage CMS to give them faster access to outcomes data. To hear more about payment models in oncology care, join us November 17th and 18th at the Patient-Centered Oncology Care live meeting, which will mark its 5th year in Baltimore, Maryland. Highlights of this year's event will include Dr. Michael Fratkin's presentation on telehealth and palliative care and our expert panel, Oncology Care in 2017. For the agenda and registration, visit ajmc.com. For all of us at the Managed Markets News Network, I'm Sarah Bellinger. Thanks for joining us.